Blame the CDC for losing the trust of the American people.
Okay, you're wrong again. Okay?
No, I'm not. We're having this conversation because the American people don't
Let's
trust
talk
the
about
CDC.
political actors who started to spew intentionally
because
misinformation
the CDC misled and lied to the American people during
which has
a
led
shutdown
to
of the world.
confusion, has led to chaos, and has led to an unnecessary loss of life.
On the most recent episode of Abby Phillip's CNN show, Abby Phillip had a panel that included Nina Turner, Dr. Chris Purnell, and MAGA stooges Ben Ferguson and Scott Jennings to talk about Florida doing away with their mandate that school children be vaccinated. Things got really heated with this debate as Nina Turner and Chris Purnell, as well as Abby Phillip, went up against Scott Jennings and Ben Ferguson. We're going to take a look at clips from this CNN show. I will share my thoughts on this as well. Let's get into it together.
Make America sick again? Well, tonight, Florida is planning to axe all vaccine mandates, including the ones for school children. And the state surgeon general used this metaphor to justify it.
The Florida Department of Health, in partnership with the governor, is going to be working to end all vaccine mandates in Florida law. All of them. All of them. Every last one of them. Every last one of them is wrong and drips with disdain and slavery.
In all 50 states, they've had school immunization requirements since the 80s. Now, this change would make Florida the first state to end the longstanding and constitutionally upheld practice of requiring certain vaccines for students. The Florida chapter of the American Academy of Pediatrics said today the move will put children in the state's public schools at higher risk for getting sick, which will have a ripple effect in the community. The CDC study also shows that routine childhood vaccines, like the ones included in school mandates, will have prevented millions of illnesses, hospitalizations, deaths, all while saving billions in direct access costs. Joining the conversation for this one is Dr. Chris Purnell. She's the director of the NAACP Center for Health Equity and Public Health and Preventative Medicine physician. And Dr. Purnell, you know this well. In 2020, we had 13 cases of measles. 2025, 1,400. A huge increase in whooping cough in this country. And at the same time, the rates of vaccine exemptions have gone up by about a point since 2019. None of this is by accident. None of this is by osmosis. And now this in Florida.
Reckless. If I could sum it up in one word, let's just go to some facts. And I have them here to keep myself honest. Since the last 30 years, we've saved over 150 million lives because of vaccines globally. If we begin to think about in the United States, we've saved over 1.1 million children due to vaccinations since 1994. We've prevented 508 million illnesses and 32 million hospitalizations. That's not anything to wink at. That's hardcore data. But what's happening in the United States is as if we are a runaway train. In public health, we talk about the cliff of good health, and we have fallen completely off of the cliff.
That's kind of what it feels like in a way, Ben, that everybody sitting at this table, all the folks in Florida, all of these people who are vaccine skeptics now have benefited from vaccines allowing them to live their lives without polio, without measles. And now all of a sudden they want to pull the rug out from underneath children. I'm surprised by it. I mean, you have kids. A lot of us do at this table. If you lived in Florida, what would you be thinking?
I think two things. One, they're not outlawed. That's good. The parents are going to decide. Two, there's a cause and effect, and the CDC lied to us about COVID, and they lied a lot. They lied about masks in school.
Not true.
They lied about distancing. They lied about the efficiency or the effectiveness of the COVID-19 vaccine.
Not true.
It is true. They said that distancing. Hold on, wait. Did they not lie about the effectiveness of a mask when internal documents said that the mask did not work in the schools?
If we're looking at high quality masks, right? So P95 masks, those masks actually prevent infections. Because look, this is the way science works. Science works that as you get data, the type of communication that you give will improve.
This is what
But you can't say the CDC lied.
Florida's doing right now.
You can't.
What these clowns like Ben Ferguson never want to admit is we were in the middle of a pandemic and scientists and doctors were figuring all of this out on the fly. It wasn't like something like polio, where we have known for decades and decades and decades that the polio vaccine works and keeps people from getting polio. So again, this is Ben Ferguson. Scott Jennings does the same thing. Every time they're on Abby Phillip's show, they are disingenuous. They spread misinformation and disinformation. This idea that the CDC purposely lied to people. Some things, did they get some things wrong? Well, they were figuring it out as they went along. We were all figuring it out as we went along. I remember in the very beginning, people were saying, when you brought your groceries in, that you had to wipe your groceries down with rubbing alcohol or whatever to make sure that, there weren't germs on them. And then people said, no, you don't need to do that. We're not doing that now. But that really has nothing to do with, as Abby Phillip said at the top, schools across the country have had vaccine mandates since the 1980s. So now, because of some kooks like RFK Jr. have gotten into very powerful positions, people are now questioning ideas that were already settled decades ago. And the result is going to be that people are going to get sicker, as the doctor here, Chris Purnell, said.
Hold on. I actually think it's important.
It's very important.
If you're saying things that are not accurate, I do think it's fair for her to counter that.
The CDC said that masking was effective and worked when they knew internal documents said.
It does
and the emails
work.
came out that it didn't work.
Okay, well, what
true or
she
false?
does.
Okay, 6 foot distancing.
Hold on a
true or
second.
false? The CDC say
hold
that
on a
6
second.
Misinformation,
foot
folks.
worked, and it
You're
didn't.
seeing it in action.
First of all,
they said it was going to stop the spread in 2 weeks.
Ben, are you going to have a
action.
conversation, or are you just going to keep talking? Look, hold on. Okay. First of all, what she is disputing is your language around this, which is that they lied.
Yes, exactly.
Which she's saying, and I think she's right about this, is not true. There are certain types of masks that work better than others.
We've been using masks for decades.
The whole point of science. I mean, and this is,
Abby,
I think
this is why Florida did this. And this is what you guys don't understand.
Hold on.
There's a cause and effect.
Hold
The
on.
American people don't trust the CDC.
That's why Florida did
for the reasons I said. You may not like that. You may not like the American people believe
Americans
that.
don't trust the CDC
They do not.
because people like RFK Jr. and others.
That's why RFK Jr. got the job he's got now, because so many people didn't trust the CDC.
Hold on a second. Okay, Ben, just give me 1 second, okay? This Florida Surgeon General has been railing against vaccines for a while, but he's also responsible for a lot of misinformation. He's altered key findings in a COVID-19 vaccine safety study.
Malpractice.
He pushed things like cures like ivermectin and others for COVID.
Did ivermectin not work?
No.
You have data that shows that it did work.
No.
He is pushing
We have
all of those
conclusive
other
data that it does not work effectively.
Okay. Ben, are you really going to argue with the doctor?
Thank you.
About this?
This is
With a doctor who is helping to save lives
when we all
in
listened
a
to doctors
safety net
during COVID,
institution,
you guys screwed us and we failed miserably. You lied about a vaccine.
Let me move on because
hold
on 1 second. I just want to move on because I want to let other people join the conversation. Okay. The idea that all of this can be blamed on a virus that was novel in 2020, where we did not know a whole lot, and where, I just want to play this because I think people forget sometimes, where the president at the time was Donald J. Trump, and this is what he said about vaccines at the time. His own vaccine, by the way, that he helped develop.
You tell parents about getting their kids vaccinated. Measles. I'm the measles. Measles. Tell parents about vaccinations. They have to get the shot. The vaccinations are so important. This is really going around now. They have to get their shots.
This is one of the really interesting things to me, the logic pretzels and mental gymnastics that MAGA does, that Trump's views on vaccinations has not harmed him at all. MAGA just seems to ignore that. The people who are anti-vax, they just seem to ignore what Trump says. And the fact that Trump brags about the fact that the COVID vaccines were developed while he was president. And that has no negative impact on him with the cult. It's amazing. And that's a good point here from Abby Phillip to show this video.
So that, on measles, Trump in 2019 was get your measles vaccine. Operation Warp Speed, some people say he should be nominated for the Nobel Peace Prize. Fair argument to make. But now all of a sudden, This is about being lied to when people did not know a whole lot about COVID at the time.
Let's take a big picture view. The COVID vaccine ended up being a miracle drug.
It did.
There is no doubt about that. You can say that certain people later on, in terms of booster shots, should or shouldn't have gotten this, young men, you can make all those. The bottom line is it was a miracle drug, period. We have to start from that perspective. Then you talk about other vaccines, right? We're not just talking about COVID. If COVID's an excuse to basically say, well, we can't listen to anything. They're all lying to us. All these vaccines are bad. No, they're not. They've been proven year after year, decade after decade, putting aside COVID for a minute, that the rest of these vaccines work. So the fundamental question becomes, do you view this through the prism of I, or do you view this through the prism of we?
Exactly.
If you view it through the prism of I understand the point, which is, why should I be forced to get something that I may not want to get? I get it.
It had side effects.
I hear
like
it.
Heart issues.
But look, there are medical exceptions. But there are medical exceptions in Florida where if you have a medical condition right now, you don't have to get those vaccines. If you have a medical exception,
Exactly.
The point is, if you view it as a we, as a community,
we did that, though.
Yes.
It was a failure.
So listen,
But that's the part that you're missing about the American people.
Measles has been a failure?
No. I'm going back to COVID-19 and why we're having
I know that it's
the
convenient to go back to COVID, but we're
But that's
talking...
where this started.
But we have
The
no,
CDC,
it
everyone
didn't.
trusted them
Hold on.
before
No, it didn't.
COVID-19. True or
Right
false?
now,
It was like a
in this,
90+%
hold on,
approval
Ben,
rating
right now
for
in
the
this
CDC.
country, Scott, the question is, should children going back to school, you also have kids, I don't know if they're vaccinated or not, I presume they probably are. If they are going back to school, should they have a vaccine for polio? Should they have a vaccine for measles, mumps, and rubella? Should they have a vaccine for any number of things
for chickenpox
that we don't even talk about anymore because it's not really a part of American life because we've eradicated it because of vaccines? Should they?
Yeah, I think it's indisputable that vaccines have saved millions upon millions of lives, and that these vaccines for these diseases you're talking about work. I mean, they've been working for decades in many cases. So I think that's fact number one. I think Dan raised an interesting point about you could hold two thoughts at the same time. You could believe that they work and believe that you don't have any questions about it. And you may also believe that the government shouldn't make you do anything that you don't want to do regarding health care.
Government makes you get a license.
Whether you have concerns about the vaccines or not, there are people who do not believe that the government should be able to
Government makes you wear a seatbelt.
anything like that. Well, there are people that don't think that.
They don't make you drive.
And so,
they don't make you drive.
Yeah,
so I think it's possible for people to hold. So anyway, I think that's kind of the debate that's going on.
The government
personal liberty.
That is the debate. But I think Dan's point is, and I think this is super important when it comes to vaccines. Vaccines are not just an I decision. They are a we decision because they don't work as well unless and until we all participate in them. So that is part of what was the discussion here when it comes to mandates, because we are all protected when we are as a community vaccinated. Yes. We are less protected when we are not vaccinated as a community.
The two things that are really troubling in this whole debate is the fact that we do have to collectively make a certain level of sacrifice, and getting vaccinations are part of that sacrifice with a glorious outcome for the majority with a few exceptions. And to see the president, the leaders in Florida play political games with vaccinations, to see people cheer this on, not really understanding the full impact of what this is going to do for political expediency. And the second point, very irrational, irresponsible for him to compare people having to get vaccinations with chattel slavery. There are no other atrocities. They would never make that comparison when it comes to the Holocaust, but you want to make that comparison when it comes to chattel slavery. Wild. It is reprehensible that he would do that, or anybody would do that cavalier nature. And all it continues to do is amp up the animus in this country for reasons
Can
that...
we talk about Florida specifically just for a
Yeah.
minute? So in Florida, approximately 88% of kindergartners have their full and complete vaccination. That is already below the recommended amount if you're going to achieve herd immunity. If you take away the vaccine mandates, you're going to see that number plummet. When that number plummets, not only are households going to be infected and potentially get sick, but the most vulnerable people in those households, and those are children. Without mandates, we are not going to adequately protect our children. And we've already seen, let me finish. That's not bullying. We've already seen evidence is when we don't protect children, children are left susceptible to irrational decisions of adults. We have children in the United States dead from measles. That should not happen in 2025.
Ben, how do you with a straight face?
It should not.
Seriously, how do you with a straight face can anyone justify, even if you don't like the COVID vaccine, saying that because you don't like the COVID vaccine, you should open up the Pandora's box
to everything
of diseases that we have put on the put on the back burner of public life. Why would one thing even remotely justify the other?
When you have the CDC that does not have the trust of the American people, and clearly in Florida, they do not trust the CDC with their children.
This has nothing to do with the CDC.
Yes.
This has to do with Florida public health
You can lecture the American people all you want to, but I'm trying to explain to you why parents are saying, I don't trust.
I know that you are trying to justify
it,
but
I'm justifying. It is explaining
this is actually
why
not about.
People, by the way, if you don't like us in Florida, you can move.
So if this happens nationwide, Ben Ferguson, that they drop the mandates across the country, where are people going to go? You can just move if you don't like it. Maybe the people that don't want to get vaccinated can move. Maybe they could move to another country, or they can move to the middle of the desert and make their own society where they can be happy and be away from the rest of us. Dan Abrams has a really good point when he talks about I versus we. These people like Scott Ferguson and Ben Ferguson and these other MAGA types want to not be part of a we. They believe that freedom means you get to do just whatever you want. So if the sign says no shirt, no shoes, no service, nope, doesn't apply to me. If I don't want to wear a shirt, I don't want to wear shoes, I'm going to walk into your store and, what are you going to do to me? And like Dr. Chris Purnell says here, people have to get a driver's license. People have to wear a seatbelt. Scott Jennings says, well, and a lot of people don't like that. But tough shit. If they don't like it, and that's not even something that it only affects them and, their family. If they would die in a car accident, it doesn't, they're not going to make someone else sick by not wearing a seatbelt. But if you want to be a part of a society, there are certain rules and there's certain laws. You can't just say, I'm going to drive on whatever side of the road I want and people can get out of my way if I'm on the wrong side or what they call the wrong side. That's their problem. That's not what freedom means, that you just get to do whatever you want, no matter what the consequences are for other people. So people who want to not vaccinate their children, they can homeschool so that their kids are not making the other kids in school sick. We have all kinds of mandates for what school children have to do. They're there certain hours of the day. They're there certain days of the week. Ben Ferguson or Scott Jennings can say, well, I think my kid should only go to school 2 days a week. Well, there would be consequences for that. You don't get to do just whatever you want, no matter what Ben Ferguson and Scott Jennings say. And because of clowns like them who have muddied the waters, you do have, as Ben Ferguson is saying here, you do have people who don't trust the CDC. Vaccines were not controversial until fairly recently. And anybody who questioned vaccines was viewed as a kook by the vast majority of the population. And then these Republicans like Ben Ferguson and Scott Jennings muddied the waters, and now everything is a conspiracy. And so we're going to have kids get sick in Florida because of these clowns. But let me know what you think about all this. Do you agree with Ben Ferguson and Scott Jennings on this issue, or are you on the side of Nina Turner and Dr. Chris Purnell? I think it was absolutely fantastic where she repeatedly said Ben Ferguson is just there spreading misinformation because that's what he does. But which side do you agree with? Let me know in the comments. Make sure to give me a like and subscribe. I am Chris on Culture, and I will see you in the next video.